The WHO failed in this basic duty and must be held accountable. It's time, after all of these decades. The WHO failed to investigate credible reports from sources in Wuhan that conflicted directly with the Chinese government's official accounts. There was credible information to suspect human-to-human transmission in December 2019, which should have spurred the WHO to investigate and investigate immediately. Through the middle of January, it parroted and publicly endorsed the idea that there was not human-to-human transmission happening, despite reports and clear evidence to the contrary. The delays the WHO experienced in declaring a public health emergency cost valuable time, tremendous amounts of time.
Katie Talento is the former special assistant to President Trump for health policy and is an infectious disease epidemiologist. She says Trump had good reason to hold U.S. funding to the World Health Organization.
That money has gone to incompetence, corruption, and ineptitude, and perhaps even complicity with Chinese cover-ups of the critical data that we needed about the epidemic and that the world needed about the epidemic. There has been concern about the World Health Organization for a number of years and how they've handled not just this outbreak, but many prior, including Ebola and influenza epidemics in the past. I know that when I worked on malaria years ago, the World Health Organization was the #1 driver of obsolete drugs to which the malaria bug was resistant. And we had to fight very hard to get them to change their policy. I think that they've been operating with impunity for far too long. This is an important leverage point for America towards the United Nations. It doesn't mean that there's not going to be funding forever. It means that the United States is going to extract some important reforms and improvements at the operations of the World Health Organization as a condition of receiving continued funding.
Well, Peter Mathews is a professor of political science at the Cypress College in the U.S. He joins us from Los Angeles. Thank you for joining us on the program.
You're welcome.
Do you think that Trump's criticism of the WHO has merit?
Well, I do believe that the WHO is a valuable organization. It's made mistakes in the past. It certainly has victories as well. It eradicated smallpox completely. It reduced polio to 99%. By 99%, it's virtually gone, polio. And these are some of the victories of the WHO, and it's very important to have that organization that was founded back in 1948 under the United Nations. And it needs to work, especially in this crisis of coronavirus, a global pandemic. This is not the time to cut their funding or to eliminate it or to halt it. This is the time to actually encourage and look into what they've done proper and what they haven't done adequately, and to work with them. The U.S. needs to work with WHO to get this thing under control, because right now 1.9 million people are infected in the world with 119,000 deaths. And the U.S. has over 20,000 deaths right now. This is not the time to play those kinds of games. We have to really get serious about working together as a global community. The WHO is a big part of that.
So what do you make of the timing then of Trump announcing this? Is this him just trying to deflect from the criticism that's directed at him about his response to the coronavirus outbreak?
Absolutely. In fact, there has been a lot of criticism recently about his delayed response. And, you know, he was notified of this. In fact, Peter Navarro put out information earlier in this year, in the beginning of the year, about it, or directly circulated to all of the people in the White House. And the president didn't respond to that. He had about 3 weeks in February, could have taken action immediately. Let me give you one example. He actually invoked the Defense Production Act, which enables him, if he actually puts it into use, to force the American corporations to make and mass produce masks, equipment for medical workers, and to produce ventilators. He refused to do that. He said, we're going to let them do it voluntarily. And this was a very delayed response, and he's being criticized a lot for those kinds of things. And finally, he's come aboard and is doing the right thing now in terms of the distancing of the people and you know, making Americans be really aware of the seriousness of this. But it's time to move forward together on this with the world community. And I do believe he's been trying to deflect some of the criticism that's been coming his way.
Mm-hmm. The U.S. is the largest funder of the WHO. Where do you think we'll see cuts if it comes to that? Is this going to affect healthcare workers out in the field?
Absolutely, and that's the problem because when WHO did have a problem way back with Ebola, they had a delayed response to that. Part of it has to do with bureaucracy, but also they were underfunded and overstretched. That was proven. And so when you underfund and overstretch a public agency like the WHO, they're not going to be able to respond adequately. So it will have a direct impact right now coming up with the workers that are out in the field there. And they're so important right now to reach out to countries, especially that don't have the kind of healthcare infrastructure that Europe and the US or that China and South Korea have. So we have to really support the WHO, and I think the president should really come aboard and not halt their funding at this crucial time.
All right, we're going to leave it there. Peter Mathews, thank you so much for your time. Well, meanwhile, Trump says he wants to start reopening parts of the economy before the end of this month, but he's been at odds with state governors over how to do it. John Brain takes a look at the outbreak's epicenter in New York and how lifting restrictions could impact the number of cases domestically.
A rapturous reception for 46 nurses in New York. They'd come from across America to help the city's beleaguered health service in the battle against the coronavirus.
2020 is the year of the nurse. We didn't expect to be celebrating it in this way, but it is so heartwarming to see so many nurses come from so far away